We're here today to join with these advocates in calling on the current government to better support kids in school and daycare who have type 1 diabetes. Specifically, we'd like to see the government ensure that schools and daycares provide support for insulin administration. Right now, if a child is too young to adjust their insulin pump at lunchtime, school staff cannot assist them, forcing parents to leave work to do it. Children whose parents can't do this may be restricted to older insulin injection methods and miss out on using an insulin pump with all of the benefits that entails. They'll miss out on it entirely. But this isn't the case everywhere in Canada. Provinces such as British Columbia and Nova Scotia require school staff to be trained to support insulin administration. These trained staff are typically not teachers. They're usually EAs or support staff. They're trained by a nurse, and they work in full collaboration with parents to help young children who can't adjust their pumps on their own. Parents provide the relevant information, like the carb count of their child's meal, and the staff person makes the adjustment to the pump. It's as easy as pushing a button. The reason this is so important is because most families are not in a position to take time off work in the middle of the day to support their child's insulin needs. This forces some families to choose between their job and their child's health because schools cannot support insulin delivery. One of the parents joining us here today actually had to leave her job to ensure that her child's insulin needs were met. This is a policy shift that's also recommended by Diabetes Canada, and I don't believe it's an expensive policy shift to make. It's a matter of training a couple of staff at schools or daycares where there are children with type 1 diabetes. Those staff are in full communication with and working in full collaboration with parents to support the child's needs. And when they're a little bit older, those kids become fully capable of adjusting their own insulin pump. The previous PC government made significant headway in improving access to insulin pumps and continuous glucose monitors. The previous PC government also launched a 5-year provincial diabetes action plan that was supported by Diabetes Canada. And this is the next logical step to ensure that more children can benefit from an insulin pump.
We're here today, as MLA Cook has mentioned, to ask the NDP government to continue our good work that we had started when we were in government to ensure that children with type 1 diabetes have the support they need to manage their insulin administration. There's a very low cost to provide this type of support because EAs are already in schools. And it builds on the work our previous government did to support people with diabetes, which is included in 2018. The province added coverage for the drug Tresiba, a long-acting insulin used to control high blood pressure for the treatment of type 1 and type 2 diabetes, and this is supported by Diabetes Canada. In 2021, our previous progressive conservative government invested $6 million to pay for advanced glucose monitors and insulin pumps for individuals aged 25 years and younger. And then in 2023, the age restriction was lifted. And this was supported by Diabetes Canada. In 2023, also, as MLA Cook has mentioned, we launched the Diabetes Action Plan, and that was supported by Diabetes Canada, and it was organized into 4 pillars of action: prevention, detection, management, and surveillance. So let's take the next step, take the pressure off the parents and some of the young, wonderful children that are having to experience this on a day-to-day basis and try to manage it. And they just need a little bit of help administering their insulin.
I don't think that it needs to be as complicated as it has been said to be. A lot of the stuff we're doing every day already, these teachers are being trained to identify lows. They're being trained to identify all of the other things with diabetes. So why can't we extend it to this one other issue to get a more fulsome care for our children while they're in school? So Lillian is on an insulin pump. That means that every day at lunch, I go to her school and I administer insulin for her. And then I leave and she's able to have her snack or her meal, as it were. And that has been happening since she she was diagnosed at 15 months. And not everybody can do that. I'm extremely privileged that my work allows that. And actually, we have someone here who had to quit her job because she was not able to do that. And so it really creates this two-tier system of haves and have-nots where, I need to keep my job, so my child has subpar standard of care that is no longer supported from our province and also from Diabetes Canada.
My son was diagnosed with type 1 diabetes March 14th, 2025, so just this year. I was able to keep my job until June, but I worked hybrid, so I worked somewhat at home and then somewhat at the office. And I'm about a 40-minute drive from my office to home where my kid goes to school. So taking a 2-hour lunch break just wasn't feasible anymore. I tried to take a leave of absence, hoping that it would get better within that 6 months. Unfortunately, we are still in the same situation. So I had to resign from my position so I can continue giving my son the health care that he needs. I think our kids deserve better. We deserve better.
I think there was a recent data published from the Children's Hospital that noted there are 65 to 75 kids that are newly diagnosed with type 1 diabetes each year in Manitoba, but that number is actually increasing. Overall, in the grand scheme of things, I had a good chat with Diabetes Canada about this. They don't think that it's a huge number of kids that we're talking about here, so it's not really a significant cost that we're asking for the government to implement here.